When a patient uses a cane, it should be placed A. On the side of the strong leg. B. On the side of the weak leg. C. Alternated between both hands. D. In front of the body. Answer, B. The cane should support the weaker side to help balance and stabilize the body while walking. A client with an irregular heartbeat has a pulse described as A. Regular. B. Tachycardic. C. Bradycardic. D. Arrhythmic. Answer, D. An irregular heartbeat is referred to as an arrhythmia. Which of the following terms refers to slow breathing? A. Bradypnea. B. Tachypnea. C. Apnea. D. Dyspnea. Answer, A. Bradypnea is defined as abnormally slow breathing. The term for when a person is not breathing is A. Tachypnea. B. Bradypnea. C. Apnea. D. Dyspnea. Answer, C. Apnea refers to the cessation of breathing. You are assigned to care for a patient with hearing loss. You should A. Speak loudly and slowly. B. Speak clearly and face the patient. C. Use hand gestures only. D. Write all communication down. Answer, B. Facing the patient and speaking clearly can help those with hearing loss better understand what is being said. A patient is on strict bed rest. Which of the following complications is most likely to occur? A. Increased energy levels. B. Pressure ulcers. C. Improved digestion. D. Better circulation. Answer, B. Patients on prolonged bed rest are at high risk for developing pressure ulcers due to limited movement. Which of the following is an example of an ADL, activity of daily living? A. Using the phone. B. Managing finances. C. Dressing and bathing. D. Taking medication. Answer, C. Activities of daily living, ADLs, include basic tasks like dressing, bathing, and eating. To help prevent patient falls, you should A. Encourage patients to walk barefoot. B. Ensure the floor is free from clutter. C. Leave the bed rails down at all times. D. Walk behind the patient at all times. Answer, B. Keeping the environment clutter-free helps prevent tripping hazards and reduces the risk of falls. The best way to prevent the spread of infection is A. Wearing gloves for all tasks. B. Proper hand washing. C. Using hand sanitizer regularly. D. Avoiding direct contact with patients. Answer, B. Hand washing with soap and water is the most effective method for preventing the spread of infection. Which of the following might be a sign of abuse? A. Unexplained bruises. B. Sudden weight loss. C. Increased anxiety. D. All of the above. Answer, D. Signs of abuse can include physical injuries, unexplained weight changes, and behavioral shifts like anxiety or fear. When communicating with a confused patient, it is important to A. Speak quickly. B. Use simple, clear instructions. C. Give the patient multiple tasks at once. D. Ignore their confusion. Answer, B. Clear and simple instructions can help minimize confusion and ensure the patient understands what is being asked. A patient's output includes A. Vomit and urine. B. Perspiration and food. C. Fluids consumed. D. Both A and B. Answer, A. Output typically includes bodily fluids expelled, such as urine, vomit, and feces. What is the proper technique for measuring a patient's height if they cannot stand? A. Use a standing scale. B. Measure in bed while lying flat. C. Estimate based on age. D. Ask the patient to self-report their height. Answer B. If a patient is unable to stand, height can be measured while lying flat in bed. Which of the following is a sign of dehydration? A. Dry skin. B. Rapid pulse. C. Dark, concentrated urine. D. All of the above. Answer D. Dehydration can lead to dry skin, a rapid pulse, and concentrated, dark urine. To ensure accurate blood pressure measurement, the patient's arm should be A. Above heart level. B. At heart level. C. Below heart level. D. Elevated. Answer B. For an accurate blood pressure reading, the patient's arm should be at heart level. The normal pulse rate for an adult is A. 40 to 60 beats per minute. B. 60 to 100 beats per minute. C. 100 to 120 beats per minute. D. 120 to 140 beats per minute. Answer B. The normal resting pulse rate for an adult ranges between 60 and 100 beats per minute. Which of the following can help prevent aspiration in patients with swallowing difficulties? A. Encouraging them to eat quickly. B. Using a straw for all liquids. C. Elevating the head of the bed. D. Giving solid food only. Answer C. Keeping the head of the bed elevated during meals helps prevent aspiration in patients with swallowing difficulties. A transfer belt is used to A. Secure a patient to a bed. B. Assist with moving patients. C. Prevent patients from falling out of bed. D. Measure a patient's waist size. Answer B. Transfer belts provide support and stability when helping patients move from one place to another. If a client is in shock, you should A. Give them a drink of water. B. Call emergency services and keep the patient warm. C. Elevate their head. D. Have them stand up quickly. Answer B. A patient in shock needs emergency attention, and keeping them warm helps maintain body temperature. Which of the following can reduce the risk of pressure ulcers in bedridden patients? A. Repositioning the patient frequently. B. Encouraging them to lie in the same position. C. Using firm bedding only. D. Keeping the bed in a flat position at all times. Answer A. Repositioning patients reduces pressure on certain areas of the body and helps prevent ulcers. The most common symptom of a urinary tract infection, UTI, is A. Frequent urination. B. High fever. C. Vomiting. D. Chest pain. Answer A. Frequent urination and a burning sensation are typical signs of a UTI. Before feeding a client, you should check A. Their clothing for spills. B. If they are alert and sitting upright. C. The room temperature. D. How much they ate earlier. Answer B. Ensuring the patient is alert and sitting upright helps prevent choking and aspiration. Which of the following is a sign of malnutrition? A. Sudden weight loss. B. Strong appetite. C. Clear skin. D. Stable weight. Answer A. Sudden, unexplained weight loss may indicate malnutrition, particularly in the elderly. When giving a bed bath, you should A. Start with the legs. B. Wash the patient's face first. C. Use hot water to cleanse the skin. D. Leave the room during the bath. Answer B. Begin a bed bath with the cleanest areas, starting with the patient's face. Which of the following patients is at the highest risk of choking? A. A patient on a clear liquid diet. B. A patient with a history of stroke. C. A patient who walks with a cane. D. A patient with frequent headaches. Answer B. Stroke patients are often at risk of choking due to muscle weakness or difficulty swallowing. Which of the following is the best way to prevent accidents in the home of a patient? A. Rearranging furniture frequently. B. Using throw rugs in every room. C. Keeping windows open at all times. D. Ensuring adequate lighting and removing clutter. Answer D. Good lighting and a clutter-free environment help reduce the risk of accidents like falls. You notice that your patient has a pressure ulcer. Your immediate action should be to A. Apply a dressing. B. Notify your supervisor. C. Massage the area. D. Take the patient's temperature. Answer B. Pressure ulcers can become serious quickly, so it is important to report them to a supervisor immediately. The proper way to dispose of contaminated gloves is to A. Dispose of them in a biohazard waste container. B. Reuse them after washing. C. Throw them in a regular trash can. D. Leave them on the floor. Answer A. Contaminated gloves should always be disposed of in biohazard containers to prevent the spread of infection. Which of the following symptoms is often associated with low blood sugar, hypoglycemia? A. Sudden headache. B. Confusion and shakiness. C. High fever. D. Rapid weight gain. Answer B. Hypoglycemia often leads to symptoms like confusion, shakiness, and sweating. When caring for a patient with Alzheimer's disease, you should A. Speak slowly and clearly. B. Use complicated instructions. C. Leave them alone for extended periods. D. Avoid routine activities. Answer A. Patients with Alzheimer's benefit from simple, clear communication to reduce confusion.